That's an interesting observation. Please tell me about the state of American health care in 1789. Well, it was a lot better, that's for sure. I mean, but of course, the science, when it got created and it created its societies and its associations, well, at that point, they could really put out whatever they wanted to in 1789. It wasn't like there was anybody really keeping records. But historically, the U.S. had a more open healthcare system where many doctors and hospitals made money but also provided care to the poor through charity care and sliding scale fees. Before widespread insurance and heavy government involvement, physicians often treated low-income patients for free or at reduced cost, subsidizing this care by charging wealthier patients more or through barter arrangements. Charity clinics and dispensaries also played a key role in serving those who could not pay. This system was informal and largely unregulated, relying on the goodwill of the community and responsibility of healthcare providers. However, starting in the 20th century, the rise of prepaid plans like Blue Cross Blue Shield and later government programs such as Medicare, Medicaid, healthcare financing towards insurance and government funding, over time the percentage of doctors providing charity care has declined due to the financial pressures and changes in practices and patterns. Hospitals today are required to provide some charity care to maintain nonprofit status, but financial strains and competition have limited this care in many places. So it's gotten worse, but it's not just that. Providers made more money, which is why they offered free care, because there wasn't all this regulation on them by a bunch of associations and medical societies. Then when you add the creating science itself as its own entity, its own institution, and it has nothing but unethical experimentation in its path, and it does, that's just a fact. It never stops. They never stop because they're never held accountable. Even with more regulations on them, they still do it because there's no way to pinpoint who to hold responsible for the unethical experiments. University hospitals and the scientific community have a documented history of unethical experiments on human subjects, often conducted without informed consent and targeting vulnerable populations such as racial minorities, prisoners, children, and the mentally disabled. The most famous, everybody knows about it, went on from 1932 to 72, which was Tuskegee syphilis study, where hundreds of black men with syphilis were misled and denied effective treatment so researchers could observe the disease progression. Boy, that's science progress, isn't it? Went on all that time and no scientists or doctors came along and said, this isn't right. Other unethical experiments have included exposing people to harmful chemicals, radiation, or diseases, and conducting psychological studies like the Stanford Prison Experiment, which subjected participants to distressing conditions. Public exposure of these abuses led to significant legal and ethical reforms in research, but wait, including the establishment of guidelines for informed consent and the creation of oversight bodies to protect human subjects. However, historical and occasional recent revelations have shown that the unethical experiments still continue. University hospitals have been repeatedly linked to unethical experiments, and they have and it's due to several systemic factors. They have access to vulnerable populations. Hospitals often care for marginalized groups, such as the poor, prisoners, children, and the mentally disabled, who were historically seen as fair game for research, especially when consent was not required or enforced. Before 1970, there were few regulations or ethical guidelines governing human experimentation. This allowed researchers to conduct studies without informed consent, sometimes under the guise of medical treatment. The biggest reason is, it's about the pursuit of scientific advancement. The drive to make medical breakthroughs sometimes led researchers to prioritize scientific knowledge over patient rights and welfare, rationalizing unethical practices as necessary for progress. Okay. Institutional secrecy and authority. University hospitals, often affiliated with prestigious institutions, operate with significant autonomy and secrecy, making it easier to conceal their unethical practices until exposed by whistleblowers or public investigations. Public outrage and exposure of these abuses led to stricter regulations, such as the requirement for informed consent and the establishment of institutional review boards to protect human subjects. However, it's really not followed. Investigations have found that some researchers bypass informed consent or fail to document it properly, especially when working with the vulnerable populations. Institutional culture and legacy. Faculty members trained under mentors with histories of unethical research, perpetuating problematic practices even after rules change and regulations are in place. And there's delayed accountability. Universities sometimes only acknowledge wrongdoing decades later, and individuals involved may not face consequences due to statutes of limitations or institutional reluctance. What is considered unethical today may not have been explicitly prohibited in the past, but harm was still done, and some practices persisted after new standards were established. Recent apologies and investigations, such as those at UCSF on prisoners, show that stricter rules alone are not enough. Ongoing vigilance, transparency, and a culture of accountability are also needed. One of the problems that happened was when science began to become organized in the 17th and 18th century with the formation of scientific societies such as the American Philosophical Society, which brought scientists together to share knowledge and establish standards. Over time, more formal organizations, professional societies developed, leading to structured scientific communities we see today. Major international science councils and discipline specific societies emerged in the 20th century, furthering the formalizing of scientific collaboration and governance. The culture of science alone is not what led to unethical experiments, but it played a significant role. The drive for scientific advancement, prestige, and institutional authority within these societies often created environments where ethical boundaries were overlooked or minimized. Researchers operating within respected institutions and peer networks sometimes prioritized discovery and reputation over patients' rights and welfare. When unethical experiments were published in prestigious journals and accepted by leading researchers, it reinforced a culture where such behavior was seen as standard or even necessary for progress. Despite reforms and regulations, accountability for unethical experiments is rare. Focus on investigations and sanctions typically target individual researchers rather than holding entire institutions or organizations responsible, even when systemic issues are involved. The complexity of assigning blame. Modern research is highly collaborative, making it difficult to pinpoint responsibility with large teams. Guidelines often fail to reflect who actually controls or benefits from the misconduct, leading to a diffuse accountability. Investigations into misconduct can become lengthy, lack transparency, and fail altogether. So it seems to me we were a lot better when we just had charity hospitals and doctors that were giving medicine for free. Does that answer your question? I hope so.